So we just had a lady come in, her name is Rena, and I'm not kidding, man. She walked in like this, you know, just all hunched over, and she walked out completely standing up and looking to go back to work. So it's, I don't want to like overpromise, but
I am probably the most skeptical of anyone who shows up here.
Most people are.
Yeah.
So
We welcome it.
we want that. That's the best to have, because if we can make you a believer, and we can make anyone a believer. But
Okay.
yeah, go ahead. Do you want me to get out of the way?
Yeah. No, you stay here. You stay. Ask that few questions like, what's your
Yeah, just
plan?
like,
Where
okay.
is it?
Tell us a bit about like what you go through.
Yeah. So I just right now, I guess, what is it you struggle with most, and what would you say the day-to-day pain is like for you?
First of all, please point the cameras at him.
Okay.
No, I'm just joking.
Oh, you're great on camera, man. What are you talking about?
Well, I suffer from several autoimmune diseases. You know, have psoriatic arthritis, rheumatoid arthritis, fibromyalgia, Sjögren syndrome. So I don't know which is causing me the most pain,
Yeah.
but when I wake up in the mornings, it's very difficult to get out of bed.
Hey guys, good.
Hello,
Hey, good.
good.
So this is Rhett. Rhett, this is Neal.
Hello, Neal.
He has a whole lot of pain.
Where's it hurt the most right now?
Well, you can
So he's
you can take your pick.
So why don't you tell Rhett, actually? You can tell. Well, do you guys need me to keep asking? Or
No, you're fine.
So if you want to tell Rhett what you struggle with, and then he's the master of helping people. So
So I was just telling him that I have several autoimmune diseases.
Okay.
Psoriatic arthritis, rheumatoid arthritis, Sjögren syndrome, and fibromyalgia. And you know, in the morning, it's very difficult for me to get up out of bed.
Sure.
My joints are, you know, even if I stop moving for a few minutes,
Get
they
stuck.
yes,
Yeah.
and
so
painful.
Does like your knees hurt or anything like that?
My hands and feet. My feet probably hurt the greatest.
right now, okay. Well,
This work on that, man.
can you remove your boots?
Yes.
Let's take your boots off. Let's try to help you out here. Rhett, do you want to help him?
Yeah.
Okay.
Uh-huh, yeah.
Do the place we can.
Yeah.
And I've already explained to him kind of what it is. And
Where does it hurt on your foot?
Should I remove?
No, you're fine.
It's okay. Well, from here down,
Oh, from there down.
probably
Does this one hurt the same?
yes.
Let's just put this right here for a second. I just want to test. Okay. Let's just see here for a second. It's starting right up here, right? Or is this one not starting that high?
This is harder for me to tell because I've had a major stroke.
Okay.
And took my whole right side out. Took
Yeah.
me several years to get my motion back.
Okay.
So this may be kind of
Problematic and trying to figure it out.
exactly.
Okay. Because it feels like this may work right here for that foot, but maybe there's a better spot for a second. But are you feeling any different on this foot right now?
It's hard to say.
Does it hurt standing, or does it hurt more sitting, or does it just hurt all the time?
All the time.
All the time.
It's pretty much constant.
Okay. And the other one's up high here, like this. It starts here, you say?
Here and it goes
Oh, clear up at this high.
clear down to my toes.
Okay. Yeah, okay, this is interesting.
So does that does that actually,
So
it doesn't need to be touching the skin?
no, so technology is already sandwiched between two layers of vinyl here. Okay, so it doesn't touch your skin anyway, even if it was on your skin. So we're intercepting that. The patch, it has some nanotechnology between the layers that makes it sensitive to electrical signals. So we're just trying to intercept the pain signals before it redirect them into the patch before it gets to your brain. And the patch is slightly, if you feel with the back of your hand, do you feel it kind of warmer in the middle?
Mhm.
Yeah, that's all I've been doing is feeling. See, it's not hot out here, it's not hot out here, it's hot out there. So I just been searching for that like little spot. And there may be a better spot here down low, I don't know. But I was wondering, are you feeling any other kind of sensation other than pain right now?
Hard to say. It does feel a little bit better. It may be because I removed my shoe.
Yeah. I know, it could be because you're sitting down too, right?
Yeah.
What would make it hurt more? Standing or?
Yeah, definitely standing.
Let's have you stand up.
Yeah, I want to stand for a sec.
We don't want to put you in pain, but
We
we
do.
want you to notice it.
What do you think? Is it hurt the same or how does it compare to the other foot?
Actually, it does feel better.
Okay. Is the pain down here or is it just starting to feel better for me? Where does the pain start now? Did it go clear to your toes? Did we get rid of it clear to your toes?
Yes, it does. Normally, I think it's the whole
Oh,
foot is feeling better. My heel, not
yet.
so much
Okay.
as the rest of my foot.
Okay.
Just strange.
Okay, this is starting to feel, okay, it's starting to cool off, so let's put it down here for a second, see if we can get your heel. Yeah, this is working. I just feel it at the back of my hand, it has a slight warm spot on the patch.
So, are you the technician behind everything?
Yeah.
Okay, explain. I don't know anything about this.
All right, is your heel feeling better now yet, or is it starting to change?
Yes, actually, it is.
Okay. All right, is it still hurting up high here, or did that come back since I moved the patch down lower?
No,
No,
it's
I think you had a muscle knot up here. This, I think, was a knot. Okay. Because it cooled off. And so this is starting to feel good too. It's cooling back off down here. Does it, if you wiggle around, does it hurt? Or is it getting?
Can I
Yeah.
take a few steps?
Yes. Take a walk. Take a walk on the wild side.
Okay.
Okay, you happy now?
Yes. I want you
Okay, you
to
sit down.
explain.
Your hands hurt too, you said?
Oh, yes.
Yeah, so just put this on the back of your hand. Okay, I'll explain to you. Okay, just let that sit there for a minute. Well, I'm glad your foot feels better. So you're gonna want to use it there or out here on the side of your ankle, like overnight. Okay, and that will help turn any kind of swelling and inflammation off in that area. And then you can do your other foot the next day. You can just keep moving it around, all right?
So how long does it last?
Until you lose it. Don't lose it. Okay. I always like to, that's my joke. I always ask people, how often do you lose your car keys? And they say, oh, about 3-4 times a week. I go, well, then that'll last like 3 days.
Yeah, but when you asked Rena that before, she's like, I won't lose this.
I know. He says, I'm not losing this thing.
Yeah.
Yeah.
Yeah. I'm still kind of
In amazement, I know.
well, more skeptical.
Okay, that's good.
I was gonna say we welcome skeptics.
Yes.
Yes, I'll have to watch.
100% of our users start as skeptics, okay? Because that's the thing. All right, so basically between the layers of the patch, are you getting stronger?
I want to say yes, but
Squeeze my fingers.
I'm.
I know you're
Wow.
skeptic.
I want to say a tentative yes. It's working.
I know.
Works every time.
I guarantee it works. Otherwise, we're not here to cheat people out of their money, okay? We're not here to just do magic tricks. This is like real stuff, okay?
Could you give me one of these that I can put over my whole body?
It's literally the most common question we
You wanna
get.
know what's so funny? Every single person has asked us that.
Yeah. So what you're gonna do is you're gonna put it between your pillow and pillowcase and sleep with it right there, and it's gonna do your whole body while you're at nighttime, okay?
Okay.
But you can do your hot spots first, but then just every night, just put it between your pillow and pillowcase and just let it go right. Your whole nervous system basically flows right past there, so
Okay.
they'll take the noise. They'll take the noise out for you. Okay?
And it's gotta be
It doesn't matter.
this side up.
No, don't care. It works right through your clothes. It works right through your. Okay, doesn't need to touch your skin. Like you saw on your leg here, we had it on your pants, we had it on your sock. Okay, we didn't have it on any of your skin. So it's
how-
starting to come back, or is it still
the
gone?
pain is coming back.
Because we haven't had it on long enough, so that's why I say you need to use it overnight so it can finish.
Okay.
I had a herniated disc for 10 years, and I slept with that thing for 3 days, and I don't even wear it now more than once every 2 weeks.
And
Nothing.
and the thing is,
Inflammation's all gone.
and that's how it works. So if you don't feel pain, you don't need the patch. When you have the pain, that's when you put the patch on. So wherever the pain is in the day, put it there as if it was a quarter, right? If you place the quarter on that pain point, that's where you want to put the patch. And then as the pain goes away, you slowly kind of chase it. Once it's gone, you don't need to wear the patch all the time.
He explained to you how it works?
No. No.
That's what he's waiting for.
Well,
Yes,
Brett kind of
please,
did, but
please do.
he gave him the science.
So when he's talking about the quarters, basically the bundle of nerves where it's sending is about that big, okay? That big, that's an area, so you're just hunting for that. And so you got plenty of room there to try to find it, okay? And just move it around. So you'll know, you see how fast it works, right? So you know if you'll have it in the right spot or not within a few minutes. If not, just move it left or right, a little bit up, a little bit down,
So does it work only with muscles or?
any kind of pain.
Anything that hurts.
Yeah, whether it's a headache, like a migraine or whatever, put it where it hurts.
Oh, I get them once a month
Okay,
at least.
so put it where it hurts. 2 or 3 minutes later, the pain may move, follow it. And then go down on the side of your neck after 4 or 5 minutes. After you feel it starting to almost subside, go down the side of your neck on both sides, and you'll find there's be some knots right here. Turn them off, and it'll be like golden in about 15 minutes.
We've had two ladies with fibromyalgia, 2 of them that were bedridden, no, not like,
Oh, yeah.
and both of them are pain-free now.
Wow.
So they didn't notice something for 3 days. It took 3 days for their body to shut off, but they put it right where he said. When they slept right between their shoulder blades, and they slept with it, and about 36 hours later, it shut off on them.
So Neal, if you had to say what your pain was at when you walked in, between like a 1 and 10, and where it's at now, what would you say?
Well, my hand is definitely probably a 1. It is usually probably 5, 6. My foot is, the pain is returning.
But when
But
it's at its minimum,
Yeah, when it went down, what would you say it was at?
It was a 7 to start. Probably a 4.
it went way down for you, huh?
Yeah.
It's knots back here.
I could I take a whole package of
You only need 1. You gotta go learn what 1 does. Okay? Go find out what 1 does for you before you need others.
We're gonna get you another one, a smaller size. so that you can just tuck it right in your sock.
Yeah.
And yeah.
You can keep that one as well.
You can
Share
keep
with your
both.
friends, whatever you need.
Oh, I'm not sure.
Oh, you're not sharing this?
You'll never get it back. You'll never get it back. Yeah, if you feel right there, that knot came back, but it's going away again.
It is. It actually is.
Yeah,
I'm dumbfounded.
and I can just tell by feeling this by the temperature rise on the thing. And so you need to put you need to keep it here for a while, you know, to tell the, you got a muscle that keeps turning back
Should he
on
just
there.
should he just keep the big one there then?
Probably the big one will be fine, and then
Okay.
but that's going to go away. But his heel hurts, so you put it there on the outside of your ankle.
The small one?
Yeah.
Okay, inside of my leg.
Yeah, just tuck it in your
Because that's
sock.
where the knot was. That's where you said the hurt was, right there. Yeah.
Neil, would you like a cookie?
And you can just.
Actually, I would.
You can just, are you familiar with Coban tape or vet wrap? Do you have a horse? You know when you get your blood drawn, they give you the pink stuff or the whatever.
What's your poison? We got
That-
chocolate
that
chip,
stretch-
sugar cookie, and chocolate caramel marshmallow.
It doesn't matter. They both sound good.
With that stretchy stuff that they hold the cotton ball in place. It's that tape that sticks to itself. It doesn't stick to you. So you can get a big roll of it, like at the cow ranch or whatever. They call it vet wrap to wrap horse legs and whatever.
Yeah.
Yeah, so you can just get a roll of that and just wrap it right around there to hold it in place, and it won't stick to you. It won't stick. It's not like sticky wrap. You know what I'm trying to say? It's just stuff that it's stretchy and it sticks to itself.
Yeah.
Yeah, so it's called Coban, C-O-B-A-N, or vet wrap if you go to the feed store.
Okay.
And you get about this wide of a roll of it for just $1 or so, and that will help you hold it in place.